The ice pick hovers just above your eye, not metaphorically, not symbolically. An actual ice pick, the kind you'd chip away at a block of ice with in your kitchen. Dr. Walter Freeman steadies his hand. No anesthetic beyond a few volts of electricity to stun you into submission. No surgical precision beyond his practiced thrust. In 3 minutes, he'll scramble the very essence of who you are and call it medicine. Just a little pressure, he says, as if he's giving you a flu shot. The pick slides through the thin bone above your eye socket with a wet crunch. A few sweeps left and right, like stirring soup, and you're done. You'll live. But the person who entered this room? That person dies with every sweep of the pick. Between 1936 and 1967, they did this to 40,000 Americans. Housewives who cried too much, children who misbehaved, war veterans who couldn't forget. They called it a miracle cure. Time magazine called Dr. Freeman a medical pioneer. We call it the lobotomy era. Medicine's darkest trend dressed up as psychiatric salvation, the birth of a nightmare. It began not in America, but in Portugal. Dr. Antonio Egas Moniz, a neurologist with political ambitions and trembling hands from gout, had an idea that would win him the Nobel Prize, and damn thousands to living death. November 12, 1935, Hospital de Santa Marta, Lisbon. Moniz couldn't perform surgery himself. His hands shook too badly. So he directed his colleague, Dr. Almeida Lima, like a conductor orchestrating devastation. The patient, a 63-year-old woman with depression and paranoia. The procedure? Drill holes in her skull, inject pure alcohol to destroy brain tissue. Moniz called it a leucotomy, from the Greek for cutting white matter. She survived. Her paranoia diminished. She also stopped caring about anything at all. Moniz declared it a triumph. He had discovered, he claimed, that mental illness lived in the connections between the frontal lobe and the rest of the brain. Sever those connections, cure the patient. Simple, elegant, monstrous. The American pioneer entered Dr. Walter Jackson, Freeman II, grandson of a Civil War surgeon, a man who collected brains in jars like others collected stamps. When he read Moniz's work, he saw not just a treatment, he saw a revolution. Freeman partnered with neurosurgeon James Watts at George Washington University. Together, they would perfect the lobotomy for American patients. Their first victim, patient, they called her, was Alice Hood Hammett, a 63-year-old Kansas housewife with agitated depression. September 14th, 1936. They drilled 6 holes in her skull. Freeman, ever the showman, invited colleagues to watch. As Watts cut through brain tissue, Freeman provided commentary like a cooking show host. Notice how the patient's anxiety visibly decreases as we sever the connections, he announced, though the patient was under general anesthesia and showing no expressions at all. Alice survived. She was, Freeman proclaimed, cured of her agitation. She was also cured of her ability to plan, to dream, to fully experience human emotion. But those details didn't make it into Freeman's triumphant medical papers. The ice pick innovation. But Freeman was impatient. The standard lobotomy required a neurosurgeon, an operating room, time. Mental hospitals were overflowing. State budgets were strained. What if there was a faster way? January 17th, 1946. Freeman's basement office. He'd been practicing on cadavers, inspired by an Italian doctor who accessed the brain through the eye socket. But instead of specialized instruments, Freeman made a discovery that would haunt medical history. A common ice pick worked perfectly. He called it the transorbital lobotomy. No need for a surgeon, no need for an operating room. Just shock the patient unconscious, slide the pick through the tear duct, sweep it back and forth to sever the frontal connections. 10 minutes, tops. Freeman's first living transorbital patient was Ellen Ionesco, a 29-year-old woman with severe depression. He performed the procedure in his office. No sterile field, no surgical assist. Just Freeman, his ice pick, and a woman who trusted him. She survived. Her depression lifted. She also lost the ability to feel much of anything deeply again. Freeman added her to his success column. The traveling horror show. Freeman took his show on the road. He bought a van, colleagues darkly nicknamed it the lobotomobile, and traveled across America like a medical missionary. State hospitals, overwhelmed and underfunded, welcomed him with open arms. He'd arrive at a hospital, perform dozens of lobotomies in a day, like a production line. No follow-up, no long-term care, just scramble their brains and move on to the next town. The numbers are staggering. Athens State Hospital, Ohio, 54 lobotomies in 1 week. Byberry State Hospital, Philadelphia, 23 in a single day. Freeman kept meticulous records, not of outcomes, but of speed. He was proud he could complete a transorbital lobotomy in under 3 minutes. Dr. John Fulton, whose chimpanzee research had originally inspired the procedure, watched Freeman work and was horrified. "Walter," he said, "you're not curing patients. You're creating vegetables." Freeman's response? "At least they're quiet vegetables." The perfect patients who received these lobotomies? The records tell a damning story. Women outnumbered men nearly 2 to 1. Their crimes? Hysteria, excessive emotion, defiance of husbands, menopausal syndrome. Take Janet Frame, New Zealand's most celebrated author, scheduled for a lobotomy in 1951 for schizophrenia, a diagnosis later proven false. She was saved only because she won a literary prize the week before her procedure, proving her mind valuable enough to preserve. Children as young as 4 received lobotomies. Howard Dully was 12 when his stepmother, tired of his defiance, convinced Freeman to lobotomize him in 1960. His crime? Being a normal, energetic boy who didn't get along with his stepmother. Dully survived. At 72, he still struggles with the damage. "I've always felt different," he says, "like a piece of me is missing that I can never get back." Rosemary's tragedy, perhaps no lobotomy story is more tragic than Rosemary Kennedy's. Sister to a future president, daughter of one of America's most powerful families, and victim of her father's ambition. Rosemary had learning disabilities, what we'd now recognize as mild intellectual disability, but she could read, write, do arithmetic. She kept a diary. She dreamed of teaching kindergarten. By age 23, she was becoming difficult. Mood swings, sneaking out at night. Normal young adult behavior complicated by her disabilities. Her father, Joseph Kennedy, saw her as a threat to the family's political ambitions, a scandal waiting to happen. November 1941. Without telling his wife, Joseph arranged for Freeman and Watts to perform a prefrontal lobotomy on Rosemary. She was awake during the procedure, asked to sing songs and count backward so they'd know when to stop cutting. They went too far. Rosemary emerged unable to walk, unable to speak coherently, incontinent. She would spend the next 64 years in institutions, hidden from the world. The family told people she was mentally retarded from birth. The truth didn't emerge until the 1980s. Her sister Eunice would later found the Special Olympics, driven by guilt and grief. But nothing could restore what Freeman's ice pick had stolen. The religious endorsement. The Catholic Church, surprisingly, endorsed lobotomies. Pope Pius XII declared in 1952 that the procedure was morally acceptable if used to cure or diminish serious psychic disturbances. Catholic hospitals across America began performing lobotomies. Nuns assisted. Priests blessed the instruments. They saw it as liberating souls from the torment of madness, a medical exorcism. Sister Mary Augustine, who assisted in over 200 lobotomies at St. Elizabeth's Hospital, kept a journal. The patients seem at peace afterward. Empty, perhaps, but peaceful. Surely this emptiness is preferable to the torments they suffered. Surely God approves of granting such relief. But Dr. Peter Breggin, studying these same patients decades later, had a different view. They weren't at peace. They were destroyed. The Church confused absence of complaint with spiritual contentment. The Veterans Massacre. The VA hospitals became lobotomy factories. Returning soldiers with combat fatigue, what we now call PTSD, were special targets. Can't sleep because you keep seeing your buddies die? Lobotomy. Can't stop shaking when you hear loud noises? Lobotomy. Between 1943 and 1950, the VA performed over 2,000 lobotomies. The logic was coldly economic. A lobotomized veteran required less care than a traumatized one. They wouldn't demand treatment. They wouldn't cause problems. They'd sit quietly in the corner, the war finally silenced in their heads, along with everything else. Private Roman Tritz underwent a lobotomy at the Tomah A in Wisconsin in 1953. His crime? Nightmares about the Battle of the Bulge. After the procedure, he never complained about the war again. He also never laughed, never cried, never connected with his children. His son later wrote, "The war didn't kill my father. The VA did." The dissenting voices. Not everyone bought into the lobotomy craze. The Soviet Union banned the procedure in 1950, declaring it contrary to principles of humanity. Soviet psychiatrist Vasily Gilyarovsky called it an assault on the essence of human consciousness. Dr. Manfred Sakel, inventor of insulin shock therapy, itself a problematic treatment, watched Freeman demonstrate and was appalled. "You're not treating illness," he said. "You're erasing the person." But in America, the dissenters were drowned out. Lobotomies were fast. They were cheap. They made difficult patients manageable. What more could an overwhelmed mental health system want? The slow awakening. The beginning of the end came in 1954 with the introduction of Thorazine, the first effective antipsychotic medication. Suddenly, there was an alternative to the ice pick, a pill instead of a lobotomy. But Freeman fought back. He performed his last lobotomy in 1967 on Helen Mortensen, a 57-year-old woman with depression. She died of a brain hemorrhage 3 days later. The hospital revoked Freeman's surgical privileges. He spent his final years driving across the country in his van, not to perform lobotomies, but to visit his former patients, documenting their outcomes. What he found should have destroyed him: suicide rates far above average, inability to function independently, emotional blunting that never improved. But Freeman remained unrepentant until his death in 1972, insisting he had helped more than he had harmed. The reckoning modern neuroscience shows us exactly what lobotomies did. The frontal lobe doesn't just process excess emotion. It's the seat of personality, planning, empathy, creativity. Freeman didn't cure mental illness. He performed chemical soul murder. Of the 40,000 Americans lobotomized, we don't know how many still survive. They're in their 80s and 90s now, the last witnesses to medicine's darkest trend. Some function well enough, others remain institutionalized. Frozen in the moment, Freeman's pick swept through their brains. The lobotomy era lasted just 30 years, barely a generation, but its shadow stretches longer. Every medical ethics course includes it as a warning. Every informed consent form exists partly because of what Freeman did without truly informed consent. The unanswered questions. How did it happen? How did 40,000 people get their brains scrambled in the name of medicine? Desperation played a part. The mental hospitals were nightmarish. Families were desperate. Anything seemed better than madness. Arrogance played a larger part. The certainty that cutting the brain could fix the mind. The conviction that a quiet patient was a cured patient. The belief that some consciousness was worth sacrificing for social order. But perhaps the most chilling lesson is how normal it all seemed at the time. Freeman wasn't seen as a monster. He was invited to conferences, published in journals, celebrated in magazines. The lobotomy wasn't underground medicine. It was mainstream psychiatric treatment. We look back at the lobotomy era and see barbarism. Ice picks through eye sockets, scrambled brains, destroyed lives. We tell ourselves we're beyond such things now. But are we? We still alter brains to treat minds. We use electricity, magnets, medications that fundamentally change brain chemistry. Most of these treatments help. Some harm. All of them remind us that the line between treatment and damage remains thinner than we'd like to believe. Howard Dully, lobotomized at 12, now speaks about his experience. I've spent my whole life trying to figure out what Freeman took from me, he says. The worst part is not knowing who I might have been. That's the ultimate crime of the lobotomy era. Not just the damage done, but the possibilities destroyed. 40,000 people who might have been treated differently. 40,000 stories rewritten by an ice pick. 40,000 reminders that medicine without conscience is the darkest trend of all. The ice pick is in the museum now. The patients are mostly gone, but the questions remain, sharp as ever. In our rush to cure, what are we willing to sacrifice? In our desire for quick fixes, whose humanity do we erase? Some trends, perhaps, are better